I think I'll start with in June of 2012, we were told that we had a choice to opt in or opt out of this large class act settlement. And because of some strings that were attached, we basically went ahead and stayed in the class act settlement. Originally, we were told that the lump sum of money that they owed us according to our tax records was a little over $700,000. They have done everything they can do since then to chop that down as far as possible, to where we ended up with way less than a third of the original amount that they told us. That amount is the reason that we didn't opt out of the settlement, because we felt like we could take that money and move our business elsewhere and we would be okay. We could start over. But because we didn't opt out before that November deadline, now we're stuck in the settlement, and they've pennied it down till they just can't take any more away from it at this point. And BP's been appealing the settlement, and then you have the bullshit medical part of it, that I call it bullshit medical because it's a little over 60 grand for a VU worker that's worked over 60 days, and some of our vessel opportunity workers have over $500,000 in medical bills. So now BP's, now we're going to pay, and everybody's all excited. Ooh, the medical settlement, let's go get our money. But what they're not looking at is the bigger picture, is for most people that are actually sick from the exposure that worked on this bill itself, the $60,000 is not going to even put a dent in the medical bills that they've already accumulated. There's still sick kids all over the place. It's an unfortunate situation. People don't know what's going on here, but every week somebody's being diagnosed with cancer or going in for a biopsy for some type of growth in their throat, breast, wherever, and different forms of leukemia, different stuff that's popping up with people. I've known my community real well abroad. Like, I know a lot of people. So for me to hear about what's going on in different families is not something that's unusual, but it's usually good stuff that we're hearing, or a little drama here or there. Now it's, my mom's going in for a biopsy. We got women that are in their early 30s, 2 of them that I'm good friends with, that have had their thyroid removed and all types of growths taken out of their throat. So the medical complications from this are broad. And sadly, BP's never gonna foot that bill. Never, ever, ever gonna foot that bill. The people that are actually gonna foot the bill, it's gonna boil down to your taxpayers. Because if you can't work and you can't feed your family, you certainly can't afford medical insurance. So most of these people have had to apply for Medicaid. And they've been approved because they can't work. They're sick. So ergo, the taxpayer is gonna be paying for the biopsies and the mammograms and the surgeries and the chemotherapy and the radiation and the follow-up treatments for years and years to come, if the people make it. We have a funeral here once to 2 times a week. People are dropping dead all around us. And, people are like, well, how do you go on day to day and live your life? Well, how do you not? For me to go to the school and go work the bake sale today was a fun thing for me to do. Because that's something that's normal. I'm not standing there having to have this conversation with someone. This conversation is old to me. It's been almost 4 years. Early on, the whole "I'd like to have my life back" by Tony Hayward, I had said, oh, me too, once in an interview. I'd love to have my life back. I would definitely now, after almost 4 years, love to have my life back. That would be fantastic. I would love to have my children's, my husband's, myself, my mother's, my brother's health back. I would love to have our fisheries back, our shrimp fisheries, crab fisheries, oyster fisheries, and our finfish fisheries back. Our finfish, all the way down to the shrimp, completely across the board, everything here is devastated. We've seen, last year and the year before, I was able to make up some of our financial gap by adding another business on and cutting out the dock, the truck, and bringing our catch directly to New Orleans to the different fish houses, the wholesalers up there that cut, and it goes directly to the restaurants. And I was able to make up a little bit of the loss, not all of it, but enough to make our bills last year. Mullet season come last year in October, and we didn't even pay for the stuff that we had to buy to get ready for the season, like nets and ropes and corks and a motor and building a boat and all that kind of stuff, because every 3 years we build a new mullet boat because it basically rots out. It's wood. But I was able to still pay my bills, buy groceries, help take care of my mother, help take care of my brother, things that I've done my whole entire life, I was still able to do. As of the end of November, 2 weeks before the end of November, my husband has not made any money in the clear, not $1. We have went behind tens of thousands of dollars into the hole, because you're still going to try to go work. You still have to pay for fuel, you still have to pay for groceries, you still have to pay for wear and tear on the boat. All that money still has to be paid for. Now we have, my husband and I, our 2 children, the 2 of us. My mother has cancer, my brother has cancer, my deckhand lives here. When my husband doesn't make any money, my deckhand can't pay the bills here, so we have to pay the bills here. So it's just this domino effect, and it's overwhelming, it's exhausting. Some couples, they say they love each other, but David and I have a relationship that I can't even articulate in words to explain to people what our relationship's like. It's awesome. It's a great relationship. I love this man. I married this man, and I intentionally had 2 children with this, two kids with this man. And I don't sleep at night, because if he starts breathing shallow, I jump. If he's breathing too hard, I jump. Because I don't know if he's going to stop breathing at any moment. My husband has been sick nonstop. 45 days. These past 45 days straight, right at, he's been sick. And that's one stretch. Usually it's 2 weeks. He gets better for, 7 to 10 days. Gets sick for a week. Gets sicker for 3 weeks. It doesn't go on for this long. This time it's been about 45 days. I'm taking my mom back and forth to New Orleans. My brother won't go see a doctor because he doesn't have insurance and whatever. His cancer's steady growing. It's like, I'm trying to find a light at the end of the tunnel, and it's not there. To be honest with you, I think multiple things need to be done. First of all, we need to make it to where our oil industry, instead of reacting, is acting. In other words, instead of waiting for something to break completely down and start spewing oil all into an area, they need to maintain their equipment. That is a huge issue. They don't wait. They don't go out here and fix a lever on a well or whatever. They wait for it to break, and then they go fix it. If it's not broke, don't fix it. That's the whole industry's attitude on all of it. And then once they're done pumping it out, they walk away. And then they just leave it, and it just sits there and deteriorates, and it's an orphan well, and nobody fixes it. That has to change. How we react to oil spills, because it's not if, it's when. We ran through one yesterday, or day before yesterday, offshore. Our boats did. So big that they had to go 20 miles out of their way to get around it. There's an oil spill in the Gulf 365 days a year. OMOP responds to 2 to 3 here in South Plaque in the south end of the parish per day. Per day. That's 2 to 3 in this little bitty area per day. So now multiply that times this huge oil field that we have all across the northern Gulf. There's a problem. It's a huge problem. I think that it goes all the way up to the top of the totem pole. I think that everyone in any form of office whatsoever, there should be term limits. These people that's been here 30 years, up in office up here, they're your problem. That's your problem right there. Our representatives are not our representatives. The representatives are the company's representatives. That's who they represent. They don't represent us. And I think it should be made to where they cannot take a penny, not a dime, from any industry. They're not up there hired by them. They're voted into office, and there's a set pay, and they should have absolutely no other That's a violation of ethics. It is a straight up ethics violation. So I think that there's a large number of things that need to be changed in order, because they're stripping our land throughout the entire country. This isn't just the Gulf. They're destroying everything. They're going to come in here, suck up all the resources, and guess what we're going to be left with? Dirty air, dirty land, unclean water, unsafe water. I mean, if you can't eat and you don't have any water to drink, what you got? You could pile all the money in front of you. Good luck eating it. Put some oil in a bucket. Good luck eating that too. If you don't have food or water, you don't have anything. The life that we are living in the United States is unsustainable. All across the board. You know, I mean, if people... I understand people are busy with soccer practice and grocery shopping and running errands and paying the bills and all that crap, but what are we leaving for our kids? How dare any parent just sit back and not say anything or want better? You know, every generation I've ever seen has always said, I just want to do better than what I have for my kids. Every parent I've ever talked to, I just want to do better than my parents did for me for my kids. Really? What you leaving for them?